We've been going about 3 years, and right now 21 million of the country's population is covered by an integrated care system, and by April 2021 all of the country will be covered by an integrated care system. We've got an acute shortage of people working in the NHS. We've got to look at how we retain our staff, and we need to make absolutely sure we're a flexible employer. Secondly is the digital. Without a doubt, it is a great way to transform services, not only for patients, but also for things like a radiologist or radiographer who can read X-rays at home rather than be called to the hospital. This country is facing a real problem in its health and care capital stock, and we need to work through how we're going to deal with that over the next 5 years. There are three big priorities that the local authorities have particularly said are important. The first is loneliness, and Barnsley are particularly good at this, so we're looking to scale up to see if we can do what they're doing across all of South Yorkshire. Secondly is rough sleeping. In Doncaster, they've been very successful in reducing the number of rough sleepers from over 120 to 19 right now. So we're looking if we could scale that up. Then the third is exercise. Sheffield are very good at exercise, and we're looking at how can we get to the position where you might be prescribed exercise as opposed to being prescribed a prescription. Because if you're fit and you do exercise, you will live longer and you'll have a happier life. Firstly, to try and reduce health inequalities. Secondly, to try and provide a good quality of service to all the 1.5 million people who live in South Yorkshire and Bassetlaw. And then the third aim is by all the organisations, and there are 23 of them working together, we can provide better services by being collaborative. So the next part of our plan will be to work more closely with the economy of South Yorkshire, and I think the other big area is to work very closely with schools, colleges and with universities. Well, there's about 72,000 staff work in the health and care field in South Yorkshire and Bassetlaw. We've got to get a shared vision between us all about how we want to proceed. And I think it's very exciting, and I think it's a great thing to be part of.